So I've already anesthetized his teeth. We're just going to go ahead and check. So we're going to look right here and see what we have. And so the first thing we'll do is go ahead and sever the PDL. So we said we can do this with the curette. Another way to do it is with the Orban knife. So notice how the Orban knife is angled a certain way. So we can literally just go around it. You can see some of these teeth are pretty mobile. Again, this is just a, you feel that a little bit, Colin? It's tolerable?
Yeah, okay.
All right, so now we can go with the wedge. Again, we're not going horizontal, we're going on like a 15-degree angle. So we're going something like this. So what I'm going to do is press apically and turn. And if you need more numbing, you let me know, okay, Colin? So you can see the pressure I'm putting there. We're going to do the same on this one and turn. And you can see this one's pretty infected. There's a little bit of pus coming out of that area. Same here, and turn. Okay, so we're going to go with the physics forceps. So the way we put it on is we're just going to take the bumper and pull the lip out of the way. And if you notice, when he opens really big, his lip gets really tight. So I'm going to have you close just a little bit, Colin. Halfway, right there. So if we take a look, we're going to put this so that it's parallel with the long axis of the tooth. We don't want it in this direction. We don't want it in that direction. We want to be right on the lingual aspect, following the long axis, and then we're just going to go 15 degrees. We let our patient know he's going to feel a little pressure. Okay? And then we're going to continue that movement, and you can see how the tooth moved there. Okay? So, as we mentioned yesterday, you can do one tooth at a time, or you can just go ahead and loose everything up. We know that the canine's going to probably be the toughest one to get out. So you can see I've loosened this up. Let's go to the central. Number 9. And you can see how that's moving there. Again, these are pretty easy ones. And so now we're going to go to the canine. So again, following the long axis of the tooth, we don't want to be on angle because then the fulcrum's not going to be efficient. So we're going to make sure we position that and do the same movement. So you're going to see how much force I put. Does everybody? Yeah, give them the straw there if you want. There you go. So you can see the canine, even though it looks like it would be loose, it's not that loose. So we're just going to go back into that position, do the same thing, and like I said, you can use two hands. So if I'm holding with this, I'm going to go ahead and rotate with the other one. And you're going to see the pressure's going to build up, and then you'll see that tooth move. Here we go. I'm going now to the 20 degree. There we go. Did everybody see it move?
Yeah.
Okay. So now we'll go ahead and take the teeth out. So we're just going to go ahead and start. When I take teeth out, this is pretty loose, but what I like to do is almost push apical and twist and follow the direction of where that root wants to go. Same thing. We're going to put this in, push up, twist, and follow where it's going to go. Same here. Push up, twist, and out. And obviously the canine, we're going to be very careful because it's a long root and it's angled. So we're going to push up, twist, and notice if I go a certain way, it wants to come out. So I don't want to try and pull it in the direction it doesn't want to go. I want to go and pull it out in the direction it wants to go out. Okay? Now we're going to go ahead and curette all the sockets out. So usually what I do is I go in and pull out towards the lingual. And you can see that granulation tissue. You can go ahead and suction that right there. There we go. And we'll do the same here. And then now we're going to flip and go in the opposite direction. So the good thing is, watch, I'm pressing And we haven't perforated or broken the buckle plate on any of these. So she's going to go ahead and suction that one little piece of tissue. Okay.
You want around here, or is that okay?
Around here would be a good idea too, just in case. Good. Looks like we got it, right? I heard it going. So we're just going to go one more time. Good. We're just going to go ahead and irrigate. Good. And so let me just show you an example of Osteogen and also BioViva. So here we have the Osteogen. So we're just going to try and shape that so it'll go into that socket. And I'm going to cut this in half. This way we have one for both centers. Or one central and one lateral. Let's do that. So if we take a look, we're going to put this in. Notice it doesn't want to go in, so we have to shape it a little more. Thank you. And so we'll just use our bone plugger to push that in. So here you can see we've grafted that site for him. This way it's going to maintain the ridge when he gets a denture. We're going to do the lateral for him too. Good. And then let's go ahead and do the BioViva in the other two. So we'll go ahead and put this right in here. Remember, we said if this gets wet, it gets really sticky.
So you're putting it dry, right?
Yep, put it in dry, and as soon as it gets wet, it's going to get sticky and then turn into a gel. And then we'll do the canine as well.
It's not just me. Every time I use the knee set, it pulls out of my force.
Yeah, if you notice, I'm using my finger to keep it in there. Okay, so now we'll just wipe that off and you'll see. Go ahead and suction on the bottom of this saliva dip. Thank you. Pull it just a little bit, Colin. Does everybody see how it's a very controlled environment now? Open halfway. Yep, thank you. Everybody see that, right? Okay, so now we'll just do a quick suture. So for this Stephanie, I'm going to have you just retract his lip, please.
No, you are absolutely not. You're not my way at all. Close down a little bit. Open up a little bit more. There you go.
Okay, so like we talked about, we're just going to go ahead and sort of do an X. If you just pull his lip up right here. Thank you. We go 2 to 3 millimeters apical. So I'm just going like this. The vinyl gloves aren't going on very good onto our hands because it's sort of humid in here. So you're going to see, I'm going to go ahead and tie that. Good, and then go on the other contralateral corners. Notice, look with my needle, I'm pushing the graft down. I'm not going through the graft, I'm pushing it down and then going through 2 millimeters from the pregingival margin. Okay, and then go to the contralateral side as well. Sure is. He's a great patient. Any questions? So I'm going to continue just stitching this up.